Diabetes mellitus is easiest to understand by thinking about it in terms of what is happening with insulin in our body. Insulin is a hormone that is produced by the pancreas. Its main job is to help move sugar from the blood into the cells. And so the easiest way to think about insulin metabolism is in terms of supply and demand. So our cells have a certain need for the insulin, that's the demand, and then our pancreas makes the supply of insulin. And as long as the supply meets the demand, then I can move all that sugar from my blood into my cells such that my blood sugar itself remains normal. And that's, that's how the normal state of being is. Diabetes, on the other hand, is any situation where the supply does not meet the demand. So you can't push all that sugar that you need to into your cells. It stays in the blood, and so there's high blood sugar. So just conceptually, that's what any form of diabetes mellitus looks like. So we have type 1 diabetes, we have type 2 diabetes. What's the difference? Type 1 diabetes, strictly by its definition, is that it's an autoimmune condition. The immune system attacks the insulin-producing cells, and so the pancreas can no longer produce enough insulin. So that causes a supply problem. So people with type 1 diabetes are not able to make the right amount of insulin. So in order to fix that problem, of course, we have to give them insulin to get back to baseline. So that's why anybody that has type 1 diabetes is going to require insulin, and that's a fundamental thing that's necessary to treat it. Whereas type 2, on the other hand, is more of a demand issue. So you're making enough insulin, so the supply is there, but the demand for the insulin is too high. And the other way that sometimes that's referred to is as insulin resistance. There's more resistance to the effects of insulin. What drives the resistance in the first place? There are multiple factors, but usually the one that is the most important to key in on is weight. So as our weight rises, we become progressively more resistant to insulin. Now, just because we gain some weight doesn't necessarily mean that we become a type 2 diabetic, and that's because many times our pancreas has the ability to make extra insulin if it's necessary. Now, everybody's different in this regard. Some people have, very large stores of insulin production capability, and others don't. So that's going to, change, when they run into the problem. But in any case, how this would usually go is that as the weight rises, that causes the demand for the insulin to rise. And then if it's able to, the pancreas just kicks out extra insulin. And as long as it makes enough insulin, then the blood sugar is normal. So what's the problem with that? Well, the problem is that insulin does more than one thing in our body. And the worst thing it does, it makes it easier to gain weight and harder to lose weight. So many times, if we gain some weight and that demand goes up and we make extra insulin, it sets the stage for additional weight gain. And that's going to lead, of course, to then more demand for insulin, so that resistance will ratchet up again. And so this just keeps happening until you get to the point where you can't make any extra insulin. And so, again, the result is the same, not enough supply for the demand, so the blood sugar is elevated. So those are, I'm going to talk about things related to this in other videos in more detail, but this is the easiest way to understand the dynamics of diabetes. Again, mostly type 1, type 2, there are others, but really I think it's easiest to think about any form of diabetes is in terms of what's happening with the supply of insulin, what's happening with the demand, and then once we know where we are with both of those, we can figure out the best way to manage